Hi, I'm Dr. Mayank. I'm a board-certified plastic surgeon and a diplomat of American Board of Hair Restoration Surgery, performing hair transplants in New Delhi for the past 12 years. Whenever we want to go in for a hair transplant, the first concern or the apprehension which arises is what is going to be the journey like? What would happen in the consultation? What happens in the process after that? So let's talk about step by step how we go about for this process. The first interaction that you would have would be with your hair transplant surgeon during your consultation. That is the time when the surgeon evaluates what exactly is your expectation, what is the donor, what is the recipient, whether the donor is adequate to give you the coverage of the recipient, whether your expectations are realistic, what exactly can be the best solution that can be given to you. Along with this, we also do the folliscopic analysis where the determining factors of the recipient bed and the donor examination is further evaluated so that there should not be any secondary ailment or secondary pathology of the skin which is along with the typical male pattern baldness. Once this plan is discussed and mutually decided upon, then obviously the calibration of the number of follicles or the grafts is usually discussed depending upon what the clinics usually talk about. The technique, how we are going to proceed and what is going to happen during the process and how is going to be the recovery and the later on things are usually discussed in the consultation, following which you are usually given the kind of tentative financials that you're looking at for the process. Once you decide to go in for the surgery, the first thing that comes is your preparation. So the preparation starts from the day post the consultation itself, where if you are on any kind of supplements, multivitamins or any kind of addictions, then usually you are asked to get rid of those. Also, you're given a set of investigations to be done which would have a complete blood profile along with your ECG and medical fitness. When everything as the investigation is considered to be within normal range, then you decide for a date where you go in for the surgery. When you arrive for the surgical procedure on that day, the discussion what you had during the consultation is usually reinforced again. The discussion of the placement of the hairline is made again, your donor recipient is evaluated again, and then the plan of the technique is usually implemented. You are also given a test dose of the local anesthesia on the forearm to check for any allergies. IV cannula is also put on your veins so that in case of any emergency, you would have the access to give any medications. Post this, you are given the local anesthesia for the surgery. To make it comfortable, we see to it that it is done with the help of a numbing cream and some vibrations are used along with that so that the pain and discomfort is minimalistic. Following which, the technique, whether it is FUT or FUE, is initiated. So the extraction of the follicles happens. If it is FUT, then the stitching of the donor area happens. And in the meantime, the strip is passed on to the technicians to start slivering and dissecting into individual follicles. If we are undergoing the FUE process, then individual follicular extraction is usually started. Few follicles as test grafts are taken out, and then the recipient bed is then created where the slits which would give you the angles, the directions, the arrangement of hair, the density, all these steps are usually performed. Once we know the length and the caliber of the hair follicles, only then we go ahead with the slit making. Once the slits are in place, then we simultaneously keep extracting few hundreds to thousand hair follicles and keep implanting them simultaneously. If it was FUT, once the stitching is over, the bandage is opened and then you would again go in for the slit procedure where the slits are made exactly the same way how it was done in the FUE. So in FUT also, the slits and the arrangement of hair follicles is exactly the same like FUE. Post this process, you are given usually short breaks in between for your lunch or your washroom breaks, and following which the implantation of the follicles is completed. Once the implantation is completed, you have a bandage on your head and you go back home, and then you're called after 48 hours usually for the first shampoo to be performed at the clinic itself, where you're taught how you're supposed to clean your scalp. The recovery phase usually involves some amount of antibiotics, some painkillers, and it's usually a very comfortable journey. Not a lot of pain or discomfort is something which you should be looking forward to. Once this phase is over, you need to follow some precautions post-surgery for approximately 3 to 4 weeks. You should avoid any kind of vigorous gymming, jogging, swimming, etc. And anything which would cause excessive perspiration should be avoided. Your direct exposure to sunlight should be avoided again, and you should avoid any dust exposure of pollutants onto the transplanted area for the initial few days. Post this process, you would see some amount of shedding happening over a few weeks, and then you would start seeing the growth over 2 to 4 months, which would thicken up with every passing month up to almost a year when you have your complete result of the transplant on your scalp. What you need to be very sure about is that once this process is done, the initial 5-6 days of the procedure, you need to start with the medications to prevent further progression of hair loss, which should be discussed by your surgeon with you so that you are on the same page of utilizing these medications to prevent further losses and progression. Whenever we are looking for the hair transplant surgery, there are a few facts which we should expect, which would be discussed in detail in realistic expectations expected from a hair transplant surgery very soon. I hope you get a fair idea about the journey and the sequence of step-to-step process of this surgery, starting from consultation to your result. If you have any further questions or concerns, please feel free to contact the numbers given below, or you can put it in the comment box down there. I would like to thank you for sparing time to view the entire video, and I hope you have liked the content. If you have, please do like and subscribe to the channel for further informative content, which is going to happen over the next few weeks, which we are going to post. Thank you so much.